is Hamilton Moreira. I'm a physician in southern part of Brazil, and I'm quite interested. My main field of interest is IOL for correction of presbyopia. That's something that we have a big field of interest in Brazil. Okay, the Lenstar for us is something very important. It's an issue of trust, an issue of really confidence. It's not something like that you can exchange from one to another equipment when you're doing your biometry, especially because of the K readings. The Lenstar is an equipment that gives us the K readings better than the other ones that I have already used. And sometimes you have a little difference between topography and the Lenstar, and then you go with the Lenstar. Usually that's what we do over there. And also another variable that's very important for us is the lens thickness. Some equipments, they don't give a good lens thickness measurement, and for us, especially when you're talking about the lens position inside the eye, the lens thickness is a variable very important to be measured nowadays. So the K readings of the Lenstar is the most important part for us, and we feel that very important and very trust in that kind of information. The Lenstar is the most important part for planning surgery. Okay, I have to screen the patient first if they have enough motivation for presbyopia correction IOLs, and then I have to take care of the cornea, especially the cornea with dry eye, and then the Lenstar is going to complete my thought about what kind of IOL I am going to use for that kind of patient. So the Lenstar with the K readings, it's a very important part of my rationale of choosing the presbyopia correcting IOLs. Oh, I use now, my routine cases is with the Barrett formula, and for that the Lenstar fits perfectly. Fits very well because I have all the variables necessary to put in the formula, and our results are very good, very trustable, very good. Sometimes, especially when you have a borderline dry eye patient, you have the topography where you're not very satisfied with the placid rings, and then you go to the Lenstar and you see that you have a constant measurement, and then that's something that you have to take care of and pay attention to, since you're going to have a better calculation of the IOL when these are repeatable. And the Lenstar is really good for that. It's very important for that, because the other equipment sometimes you have little mild difference between the measurements, but the Lenstar, it's going to give you constant readings, and this is very important for predicting and for choosing the IOL. Precision, Haag-Streit means precision. So that's how we feel in Brazil. Haag-Streit, we started with the slit lamps like 40 years ago, and it's always precision and very fine work, very fine piece of equipment that we find from these brands.